social development. Today we have Danielle Wendell, who will be presenting on preparing children and youth with special healthcare needs for puberty. Danielle is originally from Fredericksburg, Iowa, which she now again resides. She attended University of Iowa for her undergraduate and nursing degree. After graduation, she continued on in the master's program while working at University of Iowa hospitals and clinics in the NICU as a nurse. And after graduating from Iowa with her master's as a pediatric nurse practitioner, she practiced at University of Iowa hospitals and clinics in the NICU for almost 8 years, covering the NICU bays 4 and 5 and newborn nursery at night. During that time, she also obtained her doctorate of nursing practice degree at the University of Iowa. And after her first child was born, she needed daytime hours, so she obtained a PNP job at Pediatric Associates in Coralville and Iowa City. There she worked for primary care for 6 years, seeing a variety of pediatric patients, both sick and healthy. And after having her second child, she and her family wanted to be closer to family in Northeast Iowa, and she was fortunate to be offered the position she currently has with CHSC. She has now been with Child Health Specialty Clinics for 1.5 years and splits her time between the Oelwein and Decorah regional centers. Outside of clinic hours, Danielle enjoys spending time with her husband, her 2 sons, 2 and 8 years old, and her 2 crazy dogs. This session will be recorded to share with families, and then there will be a short evaluation at the end of the session that we ask that you would fill out. And I'm going to turn the mic over to Danielle.
Okay, thank you. So I want to thank everyone for coming and listening and kind of learning about the puberty for children and children and youth with special health care needs with CHSC. So kind of where I come from, like I said, I do have that primary care background, so I will bring that in a little bit here and there too. But kind of the objectives today would be to understand puberty, and then with children and youth with special healthcare needs, learning skills on how to coach parents on how and when to talk about puberty with their children, and then learning skills on how to properly teach hygiene, especially to the children and youth with special healthcare needs. So for introduction, the definition of puberty is the physical transitions or changes that occur during adolescence. Typically, this occurs around the age of 10 years old for girls, and then starts around the age of 11 years old for boys. So they also experience some cognitive and psychosocial maturation during this time also, along with those physical changes. So a lot of what occurs in puberty is due to changes in hormones. And with children and youth with special healthcare needs, these hormones may vary greatly, or definitely different than a typical adolescent or a child. So it's important to know that even in general, it can be a wide variety of ages where the puberty starts, but it may even kind of vary more greatly or widely with the children and youth with special health care needs. The other things that can vary is it can be based upon race or ethnic background, genetic factors, and body weight all affect the age of onset for puberty. So girls typically follow around the same path as their mother, so it has a little genetic components. So if they're wondering, oh, when is it going to start? I kind of ask the mom, well, when was your first period? This may be the same as, your daughter. The other thing is heavier body weight can affect the onset and have an earlier onset of puberty compared to someone that is very small and has a low body weight or BMI. And so that also stuff to take into account. And as some of the signs of puberty include the enlargement of testicles and then the penis, breast development, both males and females, then growth of pubic hair, body hair, axillary, and facial hair, the muscle growth and enlargement, growth spurt also in height, development of acne, the maturation of sweat glands, and so definitely increasing body odor with those sweat glands, and then the deepening of the voice. So these all should be monitored and then discussed with the child when starting to talk about puberty. Another thing that is helpful that I use in primary care and all I'm going to say practitioners or doctors use when meeting with children and doing their normal well child checks is Tanner staging. So Tanner staging is a helpful tool in like assessing what stage they're in, but then also helpful to let them know what's coming, like what the next stage is. Typical, at least for girls, the periods start between like Tanner stage 2 and 3. And so it's something that I would get out and talk to parents if they, have questions or are kind of anticipating guidance in what comes next, is to say, okay, well, the child is here and this is where, the next step will be. It also includes some pictures that are helpful sometimes when explaining things to the child about, what stage they're in and what, again, comes next. This one is also another Tanner stage chart that also has both boys and girls on it. And then, so along with the physical changes of puberty, we also have a lot of the psychological and social changes or well-being that need to be monitored. So kind of watching for depression, self-esteem and body satisfaction, emotions, and then risk-taking behaviors. So during the puberty, you have, like I said, the physical changes, but also the psychological changes. With depression, the rate of depression in girls doubles during and after puberty compared to that of a boy. The other thing would be earlier developing girls sometimes have a lower body satisfaction and self-esteem than later developing girls. The other thing for the emotions and risk-taking behaviors to keep in mind is making sure a lot of the, decision-making for adolescents is based upon their emotional state that they're in at that time. So making sure we're picking appropriate times to talk and discuss with the adolescent, because a lot of their thinking is based upon and around emotions. The other thing with risk-taking behaviors, during puberty, the area of impulse control actually develops at a later time than the other remainder part of the brain. So that is kind of what leads to those risk-taking behaviors and things to, like I said, all things to kind of monitor and watch also during puberty, along with the physical changes. Okay, so kind of the how and the when of like when to start talking about this stuff. So Bright Futures is kind of a guide that the American Academy of Pediatrics provides. They suggest starting, as far as the primary care provider, during the 9-year-old and 10-year-old well child check. The list of things to discuss is sexuality, kind of talking about pubertal onset, personal hygiene, initiation of growth spurt, menstruation and ejaculation, and then loss of body fat, increased muscle mass, and then sexual safety are all topics that should be addressed. by the primary care provider, but then also discussed with a child or a parent. So kind of the when, again, between 9 and 10 years old, you really want to be proactive instead of retroactive, because the child is exposed to social media, YouTube, a lot of things earlier nowadays than in past generations. And so to be proactive, you want to make sure that you're giving them the correct guidance. You should really have a list of the topics that I kind of described as far as what changes to see, and then the topics of sexuality, the physical changes, but then also the psychological changes, and kind of discussing with them. But it's good to have a list because, like me, I would be a little nervous when you're starting this talk. And so it would be good to make sure that all of the subjects and topics are touched upon or talked about, instead of, kind of rushing through and then be like, oh yeah, I forgot to mention this, or I totally skipped over that. But having a list in front of you just to help guide that conversation is beneficial. Okay. So kind of how to initiate the conversation. Here are some examples of questions that you can ask, like what changes have you noticed in your body? What questions do you have about your body and how it is developing? Do you have concerns about your body? What questions do you have, or concerns do you have about sex? But also touching on, the good touch, bad touch. A lot of peer pressure happens around this time too. So, has anyone touched you in a way that has made you feel uncomfortable? Or has anyone pressured you to do anything that made you uncomfortable or that you did not want to do? So making sure that is also included in your conversations. So for that conversation, you really want to be as straightforward as possible. Also kind of asking questions about what they've heard. In primary care, I always, ask about, are you sexually active? Are you drinking or doing drugs? That stuff. But then also, what have you heard about these things? Making sure that they understand, not everything that you hear from your friends or other kids at school is the most correct information. So we really want you to feel comfortable asking questions. The other thing would be, who do you talk to? So asking your child, or having the primary care should ask, who do you talk to about these things? If you have questions about, puberty or your body or, sex, who do you go to? Making sure that they have a responsible adult to talk with. And so again, reiterating, like, not everything you hear from our friends is the most correct information. So making sure you're asking that responsible adult, is this really true? Like, I've heard this, does this happen? To kind of make sure that we are, I guess, making them comfortable with asking questions, but then also making sure that they're getting the correct answers to those questions too, with a good source. So, making sure when you are also starting this conversation or speaking with the child is that you're giving them the information at the correct understanding. So a lot of, children and youth with special health care needs might have any like intellectual disability or just not processing or comprehending things as the age that they should. So if you have a 16-year-old with some intellectual disability, making sure that you are talking, but like their IQ and their functioning is at, 12 years of age, making sure we are directing that conversation and understanding to a 12-year-old, not necessarily a 16-year-old. So really honing your information and conversations to a level that is understandable to them. The Bright Futures and Up to Date, they both have information that is helpful at a 5th and 6th grade level understanding. So they have a handout for like the basics about puberty, and again, written at a level that should be understandable to that age where they are starting puberty. The other thing is making sure we're doing the teach back method. So, asking them these questions and then kind of giving them information, but then also having them repeat or tell you the information back to kind of see if they fully comprehend it. Because if you tell someone one thing, but they kind of think about it or process it a little bit differently, and it's a good way of knowing how they're processing it or what they're really understanding as far as, what will happen next, regarding body changes. So again, just ensures understanding to have them tell you the information back. Okay. So another thing we are, for the objectives today is learning hygiene. So as a child goes through puberty, a lot of those body changes kind of in turn call for changes in that hygiene. So making sure a child is bathing every day, making sure they're using soap. They, using deodorant, whether, with or without antiperspirant, it's really up to them and the parent, but making sure that they are knowledgeable about, those increased sweat glands are going to start producing odor because of hormones, and kind of making sure they understand the purpose of these hygiene techniques too. Washing their face daily, twice a day, and making sure we're not just, using regular soap and water or just water, but using a face wash that's going to be helpful, but then also moisturizer. I had a lot of kids will just, wash their face because it's oily and they're having acne, and they'll wash it, but they won't use moisturizer, which in turn causes even more acne because the face will start drying out and then it produces more oil. And so it's important to, wash, but then also use that moisturizer and explain kind of the importance of that to not dry out the face and then not cause more oil and cause more acne. So the other thing, brushing teeth and flossing, they should already be doing that, but just, making sure that they know that this is still important to do. Shaving, then kind of management of wet dreams or ejaculation for boys, and then discussing menstruation and pads and tampons with girls. So again, like I said, for the bathing, deodorant, face washing, all of those things are important to ensure their understanding of why they're needing to do this. For bathing, one thing also is kind of focusing on washing genitals, armpits, areas where they might not have been as thorough as prior to puberty. The other thing would be teaching for shaving, teaching the proper technique, talking about the care of razors, what we should be doing, how to properly, use them and take care of them too. The other thing would be with the wet dreams and ejaculation, kind of understanding that this is a normal thing that occurs. It's actually caused by a surge of hormones that happens at night. So understanding it's a normal thing for them to do. They really have no control over it. But then also if it occurs, not making it taboo for them to tell you about it, but then teaching them how to properly, change, bed linens, or how they should be disposing of sheets or clothes and not hiding it. The other thing would be for menstruation, really talking about pads, why they use them. The other thing would be disposal of the hygiene products. So when we're talking about hygiene, like I said, kind of going down the list and explaining, why it's important, but then also doing visuals and reminders a lot helps, especially with children and youth with special health care needs that may not, might have difficulty comprehending or remembering. But having those visuals, even in the bathroom of, this is the first step, this is the next step, or to help with reminders too. Some kids will, be on their phone if they have a phone already, and in just setting reminders as far as, okay, this is, brushing teeth in the morning and at night, or, this is the time for a bath or a shower. So adding some of those might be helpful. The next thing would be, I might have skipped over something, sorry. The other thing I was going to say here for the hygiene in ways of helping them is just to be as consistent as possible with your expectations. So that's the other thing as far as timing goes. If it is expected for them to bathe every night and wash their face, being as consistent as possible. And yes, you may have to say it, over and over, but hopefully they will get into the habit of doing those things. And it would be helpful that way. Okay. Here are some information as far as some websites that are good with patient education, talking about, like I said, the basics, normal puberty. The American Academy of Pediatrics also has a lot of information and additional links to websites for children and for parents too. So that is another link that had a lot of information and helpful. So kind of summary, when starting to discuss about puberty, we really want to be, again, proactive instead of retroactive, just with all of the information that's out there. Making sure the conversation is very open, straightforward with expectations and what will be occurring next. Matter of fact, kind of stating how it's going to go. The other thing would be tailor it again to the child's needs and understanding. Having those consistent expectations with the hygiene is going to be beneficial, and then just continual discussion. So because there will be continual change. So we want to make sure that we're continuing to assess both by, you can kind of see the physical changes, but also what's going on behind those physical changes too, like their understanding, like emotional well-being, and kind of keep it open, very open discussion. Okay. Any questions? I know that was I rambled a little bit or kind of went through it fast, but is there anything as far as questions that people have? No? Wow, I went through it way faster than I thought then. And then here's just some of the references too that I used. But there is one in the chat. Okay, Any tips for when they don't want to do the daily hygiene? For behavioral kids, we usually say, like I said, keeping everything as consistent as possible. And if they don't want to do it, potential removal of different things. So say they really want to go and, go hang out with friends this day, or they, want to watch their show at night. And it's really taking away that until they do, an activity or do a hygiene. The other thing, if that doesn't seem to work, but you could do the positive reinforcement or like the token economy, as far as having a behavioral chart or a hygiene chart, really even, and earning so many points or so many, stars, whatever works with the child, to earn a special, game or outing or something like that, that will, like an incentive. And they can even pick that incentive. Now, make sure you have that incentive with you or at home if it is something like physical, because based upon, again, the patient's kind of IQ and knowledge or understanding, that kind of behavioral chart and earning something may not work if once they get to the point they earn something and it's not there, then they may feel like, oh, well, that was pointless. Why did I do this if you're not even giving it to me? And you might have problems with, that instant gratification kind of thing. So that may be an idea as far as, like I said, encouraging that behavior. The weight impacts, said curious about how their weight impacts earlier onset of puberty. So like I said, the higher the weight, the earlier the onset, and it is just that weight in general can affect their hormones. And so with the hormones then affects the onset of the puberty. Does that make sense? So whereas the child with the lower BMI or the body mass index or a lower weight isn't going to have as much of that body fat, and so the hormones are going to be different. Kind of similar to like athletes that are very like athletic, a lot of like, cross country runners, their period is affected by their physical activity. So a lot of like really strong athletes actually don't have periods a lot of the time because of that body weight and hormones and how it's affected with the effects on those hormones. Okay. Okay, so good question. At what age do you refer to endocrinology if puberty has not started? That's a tough one because it, again, kind of varies widely. You go back to the Tanner stages, and that's something, again, like I said, to share with family and parents, and then so they can kind of keep an eye on things also. But I think the guidelines are, if they like haven't even started Tanner's like 2 or 3 by the age of 13 to 14, then that gets referred to endocrinology, because again, puberty and menstruation, especially with girls, can vary in between, like at the start around 10, can be as early as 8 and 9 sometimes, but up to 16 to have like a period. So it just, again, varies widely, but if they're not having like any signs of development for the Tanner stages, their hair growth, then typically 12 to 14, depending on the person. And that's another reason why I always ask, like, the parent, when did you notice this? Do you have any concerns about, the development? And if they're like, oh yeah, I didn't have my period till I was 16, or I didn't even have any growth or, any hair or breast development until I was 14 or 15, then it's not as concerning. But you also kind of watch their growth chart too. If you notice a kid with, really, things like low height and weight, that's just not growing appropriately, even minus, or not even looking at puberty, that would be something to send to endocrinology. Okay, so, okay. Another question is, do you have any advice for families who see an increase in aggression due to puberty? So yes, and I think I had that written down one in my notes, but I totally skipped over that. But yeah, are in my head. But so normal puberty stuff, again, with the emotions, you can see the increased aggression, and some of that is normal. Now, if we feel the aggression is getting in the way of normal functioning and social, interactions, that's when we kind of, bring that up, as far as, different ways of dealing with it too. We, being in the decor and ON, we see a lot of like mental health, behavioral health, kiddos. And so baseline aggression is a lot of what we see, but it definitely can increase with age. The number one thing we say is really counseling, getting them into a counselor or therapist to kind of discuss information or discuss coping mechanisms of how to deal with that increased aggression. Again, being very consistent with your expectations and can help decrease, because if they're gonna push you, they're gonna push you. And if you kind of give into different things, and I should state it's there's physical aggression and there's like verbal aggression too. So it depends on where they're at in that aggression. If they are being very physical and this is not appropriate, that's when that counseling and then maybe even medication would be beneficial. Does that kind of answer your question? Okay. But being consistent with that expectations, and if we're being aggressive, having that discipline too, and being consistent with that. So for children who are showing signs of early puberty, including aggression, should they be seen by an endocrinologist? So that depends on what signs they're showing. Aggression, like I said, that it varies because a lot of kids can have just baseline aggression, especially if there's a lot of stuff going on outside of the home or in the home. So that's something to kind of watch for too, as far as the social well-being, and to see what's the cause of that aggression. Is it just purely hormones, or is it there's something else going on that is leading to that aggression? The early signs of puberty, if they are having a lot of hair growth prior to probably 9 to 10, like if they're already in like a Tanner stage 2 at that age, then that would be a referral to endocrinology. So let's see here. Do various diagnoses affect puberty that we know of? That I have not seen any specific, when I say specific diagnoses, but basically a lot of it, anything that has that hormonal impact. So a lot of the syndromes do have impact on hormones, like Turner's syndrome, let's say Beckwith-Winnie Wiedemann also are two off the top of my head that for sure do have effects on the hormone and can affect the puberty. But as far as specific ones, it would be taking when we have a child or youth with special health care needs and they have some diagnoses, kind of looking at that diagnosis and kind of exploring, you know, what hormones does that condition affect, and you know, seeing if that's gonna affect that puberty. I was gonna say Down syndrome is one that also would. So, okay, one other question. So curious about how a family could navigate changes with a child who is nonverbal. A lot of pictures, like I said, that's why I kind of like the Tanner staging. And so if they, again, you know, their understanding or IQ probably affects it too. But showing pictures, and that's another one with, you know, girls in menstruation or, you know, boys and the ejaculation or anything like that, kind of understanding, showing them pictures of what things are, and then what changes will occur. As far as the Tanner staging has pictures of hair growth, it has pictures of like the testicular enlargement and then penis enlargement, and in girls again, the pictures of hair growth basically in the genital area. That's another thing with the hygiene. Like I said, not just talking to them about it, but then showing them, you know, how do we apply deodorant? You know, how do we dispose of things? You know, truly with girls, as far as, you know, how the pad goes in the underwear, you know, when the timer, again, reminders, you know, changing every 3 hours, even putting a reminder on the phone, like, okay, you should be, you know, disposing of your pad at this time and then getting a new one. And then how to, you know, taking it out, wrapping it up, you know, not just saying, okay, this is what we do, but again, walking them through it. And so maybe with a nonverbal patient, that would also kind of help with the hygiene. But then also, again, like I said, the pictures to kind of have that full understanding. And again, the teach back method would be similar as far as not even just having them verbally, you know, teach it back or tell it back to you, but when you're doing demonstrations, have them demonstrate again back to you. Let's see, another question: how do you deal with pain with the menstruation for youth who are nonverbal? So I feel like parents, you know, have a really good handle on when their child is in pain. And so, you know, looking at those nonverbal cues as far as how they're feeling, but monitoring that and potentially, you know, providing the ibuprofen or Tylenol to help with that menstruation pain. And kind of, you know, explaining or talking with them to their knowledge of kind of what is going on with their body and why they're in this pain, but then also, you know, reassuring them that there are things that we can do to help with it. That makes sense. Okay. Any other questions? No,
I don't see any more in the chat. But thank you, Danielle. This was a very informative presentation. I feel like we have gained a lot of knowledge on how to help families navigate through these awkward conversations. So thank you very much. It's
You're
it's
welcome.
always nice to hear from one of our own staff. In the chat is the evaluation, and we are just asking that everybody please complete that evaluation form before you get too far away today.
And real quick too, I added the registration link in case people didn't download the Zoom link onto their Outlook calendars. So if you want to do that, you can just re-register, and then after you register, there'll be an option for you to download to your Outlook, Google, Yahoo Calendar. Make sure you download it to your Outlook calendar so then you have it for future series sessions. And please feel free to let me know if you have any questions about that. All right. Thank you, everyone.